Hi friends, it is my honor to introduce you to Dr. Aswani K. Rajan, AIIMS rank 40, May 2018. Awesome performance. How
Thank
are
you,
you
sir.
feeling today?
I'm very happy, sir, and I'm very relieved also.
Yes.
Yeah.
I think, in the mid-year exam, the relief becomes more than
Yeah.
happiness.
Yeah, sure, definitely. Yeah.
I know. So I would, in the beginning, congratulate you on your
Thank you, thank you.
achievement.
Yeah,
It's a
thank you.
landmark achievement, and I'd like to congratulate your family members, your
Yeah,
mother,
yeah, of
father,
course, of
and your
course.
parents. They
Yeah.
have that significant role to
I
play.
know, I know.
Yes.
Without them, I couldn't have done
Yes,
this. I
because
am very grateful to
in the
yeah.
end, it's all about family supporting you in
I
your
know,
tough times.
and my friends also and
Yes,
teachers also,
yes,
they have contributed a lot
yes.
into this. Yeah,
So I think these are the pillars of anybody's
yeah,
success.
definitely.
Friend,
Yeah, yeah, of
family,
course, of
teachers.
course. Yeah,
Yes. So now I'd like to ask you about your test and discussion experience.
yeah.
That when you came to DAMS in test and discussion,
Mhm.
were you happy with the format, the scheduling, the test papers, and rapidity of the things because we were targeting the mid-year exam?
Yeah, actually, in fact, I needed a schedule for the exam because with our own schedule, I don't think that we really stick to it.
Yes.
So,
You can tend to overdo.
yeah, yeah, that is the thing. With this schedule, we can actually finish the subjects on time. So that was really useful. I mean, it's better. I used to read the subjects before the class, and then I give the test and revise the notes again the next day. So that way, I am almost done with the subject. So yeah, it was the schedule was really useful.
Did you try to follow the schedule religiously?
Not really.
Almost,
Yeah,
almost,
almost,
almost.
almost.
And when you came to give the test, what was your approach? Did you look at what you have done wrong, and what was your approach?
Yeah, yeah. I used to give a test. After that, I used to mark the wrong questions and then I'll see it once more.
Okay.
Yeah,
It's very important to see what you've done wrong,
yeah,
and I
yeah.
think that is the highlight that I've seen most of the rankers are doing. They do a
Yeah,
test, then they see what they've done wrong, and then
yeah.
learn, and then don't make the same mistake
Yeah,
again.
yeah. Even after giving the test in the online, we can
Yes,
bookmark it
bookmark.
and
Yes,
see it
yes.
later.
So, did you utilize the online test app that we have for the grand
Yeah,
tests and the
yeah.
videos?
Also, while I did at the house job also in along with it,
Hmm.
so while I was sitting there, instead of wasting time, I used to go through the answers. So,
Yes, yes.
yeah,
And that's a very intelligent thing to do. That can, help you to fill up the gap.
yeah,
Even when
yeah,
you're,
yeah.
sitting in the, doing nothing in the ward. Sometimes you're
Yeah.
sitting and you're still finishing
And
work.
we cannot sit and read a topic. Instead of that, seeing
Yes,
the questions, I
yes,
think is
yes.
better.
That's a good idea. And did you bookmark questions for revision later on?
Yeah, yeah,
That's a good idea,
yeah,
actually. That's a very good idea because you can't see everything in the end. It's time is so short.
yeah, I know. Huh.
Yes, that's a very good idea. And did you utilize the videos after the grand test to understand the
Yeah,
concept?
for some topics I saw the videos and they were very useful. And it's like how to approach the questions, so how to rule out other options, and they explain everything. So, and sometimes we are not really in a mood to sit and read all the answers,
Yeah.
so we can just sit back, relax, and see the video.
Plus,
So,
I believe that a lot of students, they come and tell me that they are able to hear the teacher's voice in the
yeah,
exam.
yeah,
So it's better that
that's
he
it.
speaks rather than,
We'll
the
retain
that
more.
written material and
Yeah.
collecting so much. Yes, yeah. So I think the spoken words are retained longer.
Yeah,
Maybe
yeah.
that
And also
works.
in the afternoon, while I'm a little sleepy and all, I
Yes.
usually sit and watch
More
the videos in
passive,
the
more
more,
passive.
yeah,
You are
more
able to do
passive.
it. Yes. And did you, at this moment today of your, great achievement, do you remember any teachers from DAMS that
Yeah, yeah.
made a
I remember
difference?
Obscany class by Deepthi ma'am. It was very useful. Her notes were very crisp and high yielding, so I could use it for revising. It was very useful that way. And also, sir, your radio class was really
That's
good.
so kind.
And then Deepthi ma'am's. Uh,
Diksha,
Diksha
Diksha,
Mansur,
pathology.
yeah.
Yeah.
Pathology class was very good, and also I would like to mention Rohan Khandelwal's surgery class, especially the general surgery part, and it was very useful. Even the revision classes were really good.
Yeah,
Many
yeah,
questions came
yeah.
up.
Did you like that AIMS revision session that we had
Yeah,
conducted?
yeah, yeah,
Was
yeah.
that a
That
good
was
idea about the entire exam?
yeah, yeah, that was very high yielding,
Yeah,
and
yeah,
especially at that time, it was a
yeah,
crucial time
yeah.
period. We could
And
revise all the subjects in a limited time period. Yeah,
did you like the way teachers had picked up the topics?
yeah, yeah, definitely.
Yeah,
Yeah,
were you surprised by the the kind of
yeah,
hard work that the teachers have put in?
yeah.
Yes, yes. Yeah. So, and I also want to know that were you a part of the DAMS Facebook group as well? Did you utilize the
Um,
doubt solving
yeah,
mechanisms?
yeah. Actually, it was a very useful. After dinner and all, I used to sit and scroll through the pages, and also for image-based questions, it was very useful.
Yes.
And the pathology, the Diksha ma'am had put up very beautiful diagrams, and also,
Yeah.
yeah, it
So they
was
stick
very
to
useful.
you.
Yeah.
Yeah. Our idea is that what we are working on is we work on a principle called as repeated hammering. That we teach you something in the class, then we hammer it with some quiz
Okay.
somewhere in the
Yeah.
this, then something in the GT video, so that it sticks on and it stays around you and you are
Yeah.
able to recall it in the exam. That is the principle that we work on.
Okay.
And I hope now you can see the
Yeah.
idea that because at that time, as a student, you don't notice, but gradually when you end it, you realize, okay, they were trying to put it again and again to me.
Yeah, yeah.
That is the idea behind it. And now that you've done so well in the central exams, I want you to tell us a little bit about the exam that you faced. You gave the AIIMS exam, and how did you manage the paper on that day? Because some people were telling me that the paper was a little lengthier.
Yeah,
And
yeah.
how did you manage? How many questions did you attempt?
Actually, I attempted 181 questions.
181.
I was planning to attend more, but then I couldn't. Some questions were actually difficult, so I couldn't attend more.
And I also feel that this paper in AIIMS was slightly on the tougher
Yeah,
side
yeah.
than the
It was
previous.
tougher than the November
Yes,
paper. Yeah,
because in November when I was interviewing all the toppers and talking to them, I found all of them had done more than 195.
yeah.
Here I find the average number of attempts is slightly lower this time.
Yeah,
That is a
yeah.
mark of a more difficult paper, I think.
Even it was also difficult to manage the time also.
Yes,
So,
this
yeah.
was again unique for AIIMS. Where usually in AIIMS time is not a
Not the-
concern, but this time
yeah.
the length of the questions probably was
Yeah,
longer. Yeah, more close things I think. And then when you went to give the PGI exam, how did you find the change and difference?
PGI, I was relaxed after the AIIMS
Yeah,
result, so
yeah.
I was cool.
So maybe too cool that the rank fell down.
I'm overconfident also.
So you started guessing on one. PGI, the negative marking is very high actually.
Yeah, that is it.
Yes, you have to be more guarded, I think. And that's it.
But still,
You have managed to get a very good
Yeah.
rank. Yes, I am so proud of you. And I also want to know from you now that any topics that you feel November AIIMS aspirants should look at. Like if somebody's asking you for advice that tell me what topic should I read.
Yeah.
Any topics you want to say?
I think it's better to focus mainly on the first year, second year subjects, and also on some minors like forensic and orthopedics, because it's difficult to retain those topics. And also final year subjects, it's easier to answer the final year subjects because we have the basics and so
And in AIIMS they try to put basic sciences as the
Yeah.
underlying theme.
yeah, that is
So that even in clinical they want you to tell something about the pathophysiology or something about
that
it.
is
Yes,
the-
that works.
It's I think it's better to go through those subjects like 1 week or 2 weeks before the exam. So actually I did that while I was giving the test also. I knew I had to revise those topics again. So
How many days did you allot for revision?
actually I was planning to start revision by 15th of March, but I could only start it by the second week of April.
That happens actually. Happens. Syllabus is too much actually.
Yeah, that
So you got I think 20 days to revise.
Around
So in
20
20 days you managed to look at your
One
notes.
thing
Or
I did was I did the previous year paper before starting to revise a chapter. Subject I did the previous year papers for that subject, so that I can focus on the important topics. Instead of,
at least you could not miss out on something which is important or a trend that you could pick up. Like they go towards parasitology or mycology and and you end up reading only bacteriology. It's a good idea to look at last 3 years papers and to
so that,
form a
that
strategy.
way I'll cover the previous paper also along with
But they don't repeat much, but that
Not
gives an
much,
idea,
but
gives
yeah,
an idea that how the paper is going to be structured. And do you feel that after this achievement today and that what you've done, do you feel that you would be opting for a branch here or any branch have you finalized already in your mind?
I haven't really decided it yet,
Yes.
but I'll keep PEDS as my first option. Then I also like ophthalmology, so
Okay. Let's hope for the best. Let's hope
Yeah.
that you get your branch of your choice. And I would now like to ask you to, I like to ask you to put you in a hot seat and ask you to say something motivating to future aspirants.
um, one thing I want to say is that believe in yourself. That is the thing. And then also be confident and plan everything. Stay focused. That is more important. I mean, we cannot read everything. So instead, study smart. That's
Yeah.
it.
So stay positive, study
Yeah,
smart.
yeah, and don't lose hope.
Don't lose hope, because
Yeah.
if you cannot study everything, nobody else can also study everything.
Yeah.
It is the race between the equals. Yeah.
Yeah.
So with that note, we again congratulate Dr. Ashwani for a exemplary rank and a great achievement.
Thank you.
And I am sure she will do well in life in future as well. And I would also take this opportunity to congratulate her parents on this achievement.
Yeah, yeah.
Heartiest congratulations. We are so proud of you.
Yeah, thank you, sir.
Congratulations.
Thank you so much for